Okay, I think we are now live. We'll just wait for some people to join us on the live stream this afternoon. As you can see from the title, we are doing a Q&A session here on Devon, Cornwall and Plymouth Live. This is purely for the benefit of those of you who are going to watch it back, not live, because we are just waiting for a few people to join us. I see there's about 50 people watching now. Thank you for joining. Let me know in the comments if you can see and hear everything okay. We are doing a little Q&A session on Facebook this afternoon with some of my lovely colleagues, Aaron and Daniel, who will introduce themselves fully in a minute. We decided, with the country going back into another lockdown, that it would probably be a good idea to have a discussion with two of our reporters who really have done so much work and, looked into figures. And whenever we have any coronavirus questions, we go to these guys. So hopefully they'll be able to help answer some of your questions. So if you have anything that you want to know, let us know in the comments, and hopefully we will get around to discussing it. Aaron, you're on the top of my screen, so I'm going to come to you first. Could you just introduce yourself to everybody that might not have seen you before?
Yeah, there's probably a good reason they haven't seen me before. So I'm Aaron. I'm a community reporter here in Cornwall, and I generally tend to look after all the coronavirus figures, i.e. what's the latest going on in Cornwall, and a lot of that, and a lot of trying to explain what the rules mean when we change tiers.
Very good. And then Daniel, you are over in Devon, aren't you?
Yep, Daniel, I'm the local democracy reporter for Devon, who spent as well as covering all the normal business of local councils, has sort of covered the coronavirus latest across the region.
Very good. And before we get into the heavy hitting questions, here's one that I didn't brief you on before. How did you both get into starting to cover this area of journalism with all the coronavirus figures and that?
Well, it's sort of initially, when we were talking back March, April time, there was a sort of a slight dearth of knowledge or expertise in terms of what the figures meant. And I thought it's, the simplest thing to do was to make, partly for my own knowledge, just to know how bad things actually were, where the cases are, how many, where things were rising, where things were falling, to know that, but also to provide, a public broadcast service to everyone else who can, take the figures and, do with them what they like in terms of, just letting people know how many cases there are they rising, are they falling, how does it compare to other parts of the country, and it's gone from there, really.
I mean, you do Twitter threads fairly regularly that are very comprehensive in terms of COVID figures. I know they've been really helpful for people. Aaron, how about you?
Well, quite simply, one day it was pointed out to me that we weren't doing much in the terms of reporting figures in Cornwall. It was put to me to do it. So working alongside Daniel, I started presenting the figures for Cornwall itself. And it just went on from there, really, always trying to work out better ways of explaining what it means. So obviously, when you're trying to communicate with the reader what it is, what the figures are and what it means to them, it just carry on. I ended up doing a significant amount of reading into it all so I can further how I explain that to the reader.
Which is obviously going to come in very helpful for this session here. So we've got a comment from Nathan saying, how bad is it down here? Now, obviously, Devon, Cornwall, they are two different counties, and they've had, a little bit of a different ride in terms of the tier groupings recently. But how are the statistics for COVID cases looking in the southwest, maybe compared to the rest of the country?
Compared to the rest of the country, the infection rates for Devon and to a lesser extent Cornwall are significantly lower than other parts of the country, although pretty much everywhere has seen a rise, in some cases doubling, in some cases tripling the number of cases since the end of the second lockdown at the start of December. But if you look at either sort of the lower tier authorities, so it's broken down into the district council local, so rather than just Devon as a whole, it's sort of East Devon, North Devon, Mid Devon, and so on. There's 315 lower tier authority areas in England, and the 10 in Devon are all in the bottom 15 for infection rates at the moment. So Torridge has the lowest infection rate, followed by Torbay is second, West Devon is third, North Devon fourth, Team fifth, Southam's sixth lowest, East Devon is eighth, Plymouth is 10th lowest, Exeter 12th, and Mid Devon is 15th. Cornwall has a much higher infection rate. I mean, it's double the rate of Devon. So comparatively speaking, with the rest of the country, the rates in this part of the region are an awful lot lower. I mean, we saw yesterday the ONS's figures, and 50 people in England had COVID, but for the Southwest, that was 1 in 125. The rates in Devon are about half that as well, again. So you might be looking 1 in 250 people in Devon currently have COVID. Now, obviously, those numbers, compared to the rest of the country, they're really quite good. Compared to where we were a month ago, compared to where we were over the summer, they're a lot higher. I'm pretty much everywhere in Devon is in recent days seeing cases rise. Only just looking at this, it's only sort of West Devon and North Devon where the figures are sort of more flatter and level, and not at this precise moment seeing a rise. Cornwall, obviously, it's seen a significant rise recently, going from one of the lowest areas in the country to, not one of the highest, but their rates are about 8-9 times higher than they were a couple of months ago. But I'm sure, Aaron, you'll know a lot more about what's happened in Cornwall lately.
My own interpretation of it is, as you say, things have got bad, and I think it was perhaps the perfect storm of being in tier 1 when the new variant really started to rise. So obviously a few weeks ago, there's a lot of talk about how Cornwall was in tier 1. I think perhaps part of that acceleration was the fact that in tier 1, it was expected that cases would rise. Then obviously we had the development of the new variant, and I think to a degree, while the Southwest isn't as high by a long shot as cases perhaps in London or elsewhere, I think it's sort of that perfect storm of the factors of tier 1, being able to socialise. A lot of household mixings led to cases in Cornwall, combined with the new, more spreadable variant. I think that is what has ultimately led to the acceleration of cases that we're seeing now.
And based off of like how you both have been looking at the figures for your respective areas, I mean, of course, we're not scientists or anything like that, but using the maths and the statistics with, like you were saying, the old variant and the new variant, can we expect the Southwest to continue an upwards trend, even though at the moment we are the lowest in the country?
I mean, potentially, yes. I mean, you sort of look at some areas, you've seen a huge and a sort of very, very steep rise in cases, partly, I guess, due to this new variant. In Devon, that hasn't been seen anywhere. So it's hard to know. I don't think we know for sure how many of the new cases in Devon are related to the new variant. But what we haven't seen is the same steep, sharp rises as elsewhere. And as a result of firstly the tier 3 measures and then the lockdown, there's not a significant opportunity for that new variant to particularly spike across Devon. What we should be, what we won't see in the figures is any impact of the lockdown realistically until this time next week, if not a little bit longer, due to the lag between when people get infected, when they then get a test, when the results come back, when the figures from the tests get published. So realistically, at this moment in time, we're probably still looking at the effect of tier 2.
Okay. So have we seen the Christmas statistics come through yet?
In terms of the Christmas mixing, it should start to be coming in now. The average lag from sort of infection to cases, sort of somewhere around 5 to 6 days. Then add maybe 1 or 2 days for that reporting to come through, and we're now starting to see the impact of Christmas mixing, and we'll continue to see that in terms of the cases reported over the next 2 or 3 days. Then we'll start, that should, in theory, should start to slow down with the tier 3, and then probably from the start of next weekend is when we'll really start to see the impact of the lockdown into the cases reported, and then you can probably add another week or two onto that for hospital figures, and then another week or so before it will start filtering through into deaths starting to reduce, hopefully.
Okay, and like Aaron, when we were talking about this before we went live, we were saying there is the amount of time between kind of a positive test and the hospital figures coming in, and then that ties in a little bit as well with the delay where we saw Cornwall going from tier 1 straight up to tier 3, and now we're in lockdown. What kind of happened over in Cornwall?
So in terms of in Cornwall, the government produced a heat map which indicates the rate per 100,000 cases for different age groups, split into age groups of 4 years. In Cornwall, the predominant factor is the spread of it within younger people. So under 30, there is a significant increase compared to other generations. Now, younger people are less likely to require hospitalization for coronavirus, which is why that spike in cases, particularly in the initial phase, hasn't translated into mass hospitalizations. However, if you look at the numbers for the last 2 days, which are really stuck to the kickstarter of the Christmas pattern, it's starting to spread to older generations. Now, there's usually about a lag of about 2-ish weeks, perhaps a little more, between initial infection and requiring hospitalization. Therefore, we haven't yet seen the true picture of the correlation between the spike in cases and how it'll impact on our hospitals. But because the spread initially has been within predominantly a younger demographic, we have that won't necessarily correlate to hospitals because younger people are less likely to require that treatment.
Oh, very. I mean, it's like I'm trying to like process it. Luckily, I'm just the expert in getting the StreamYard all together and getting you on Facebook. So thank you for that. Hopefully, it's making sense to people in the comments. Some people, I can't actually find a specific one, but they were asking about why certain things are open this time around versus last time around. I'll try and pop one up on the screen if I can, but can we talk about, why places like McDonald's, for example, people can visit there now, but in March that wasn't happening? Why is that?
I mean, the simple answer to that would be that, firstly, the list of businesses that needed to close this time around are different to the first lockdown and the second lockdown. So, as an example, garden centres in March, they had to close. This time, they're on the list of businesses that are allowed to stay open. In terms of like McDonald's, as far as I can understand it, the reason they can open now and they didn't, is that they are classed as an essential food store and therefore can stay open. Back in March and April, places like that chose to close rather than were forced to close. It was a decision of the businesses that, so someone like McDonald's could have stayed open throughout the first lockdown entirely, but they chose to. So it's not that they're allowed to open this time, it's they are choosing to open and stay open, which, as I'm sure everyone has seen, if you have been out into the town over the last day or so, the number of businesses that are open are much more like the November lockdown rather than the March, April, May lockdown.
Oh, very good. So that's basically kind of saying it was more down to individual kind of discrepancy back at the beginning, whereas now there's more rules in place. And similarly with like essential journeys as well, is there such a thing that constitutes as an essential journey? I know a lot of articles, we've seen comments where people say, going to click and collect your Debenhams shopping is not a essential journey. What is the deal with that?
As far as I understand it, there's the essential journey is sort of this term that has popped as a shorthand for people being able to leave their home. As far as I can understand it, there's nothing in the guidance or indeed the legislation that refers to an essential journey. The legislation is you must stay at home unless you have a reasonable excuse to do so, rather than and your journey is essential. Obviously, those reasonable excuses include, going to work if you can't work from home, going out for exercise, going shopping for essentials or basic needs or basic necessities that you can do. It's to go out to meet your support bubble, childcare bubbles, in terms of seeking medical assistance. So the essential journey, it's one of these things that sort of isn't really in the guidance or the law. It's just what has come up as a term. The thing is, you should be at home unless you have a reasonable excuse to be outside of your home. And obviously there are a number of reasonable excuses you can use. In terms of click and collect, I suspect it comes under the basic necessities clause as a reason as to why you can, as a reasonable excuse for being outside of your home, rather than it being a specifically allowed exemption.
And it's worth just we'll just take a moment in between the questions, because a few comments are coming in saying, who are these people on this panel? Well, Jasmine, I am here to answer the question. So with the country going back into lockdown, we thought it would be a good idea to take a look at the stats and figures down here in the southwest: Devon, Cornwall, Plymouth. Those are the 3 sites that we're streaming on this afternoon. I've got Aaron and Daniel with me. They are reporters at Cornwall Live and Devon Live respectively, and they have done immense amounts of research into the stats and figures since the pandemic began last year. I have done minimal research because I am just the video person here, but it is my privilege to be able to engineer this stream so that we can answer some of the questions that are maybe more specifically related to what is happening down here in the southwest. We've already been talking about how the figures and the statistics are looking down here compared to the rest of the country, how Cornwall kind of ended up going from a tier 1 to tier 3 and now into national lockdown. We have already covered why some places are open this time around versus the last kind of significant lockdown. And I'm keeping an eye on the comments so that if you have any that Daniel and Aaron can answer, then they will do so to help put your mind at ease or just help give you a little bit of knowledge. Of course, we're not scientists, we're not government officials. They are merely reporters who have just been able to do a lot of work in this particular field of journalism. And if you are going to, if you don't like it, then you don't have to watch it. If you're not interested, you can turn off. But if you have a genuine query, let us know and we'll try and answer it. So we'll go on to one that has been coming up a few times on articles, which is Nightingale hospitals. We have got one down here, haven't we? And people are wondering, why they've not kind of been making headlines and things like that. What can you tell our audience about the Nightingale hospitals, guys?
Well, the Exeter Nightingale Hospital is open. It does have patients inside it. The last figure we had was is referred to the number of patients in it on December the 30th, which was the last time the NHS England stats in terms of patients in hospital per trust was updated. There were 21 patients in the Nightingale Hospital as of that date. That was down from 28 from the 7 days previous to that, and that would have been the 23rd of December. And I think we should tomorrow get the updated figure as to what is the position in all of our hospitals and trusts across Devon and Cornwall. That should come tomorrow, and it will be based on the position as of, I think it would be 8 a.m. this morning. What we have seen in the last week is that the number of people in hospital in the southwest has risen. As of yet, we don't know exactly whereabouts in the southwest that is, and we also know that patients elsewhere in the country have been brought to the southwest for treatment because of the capacity levels, obviously, that the southwest hospitals did have. I think Torbay Hospital and Derriford Hospital were two of the three hospitals in the country which had the lowest percentage of beds being used by COVID patients as of the end of last year. So that's why then entirely possible what we will see is a reasonably large rise in the number of patients in hospital when the figures are updated. It doesn't necessarily mean all those patients in hospital are people from Devon or Cornwall. They could be patients brought in from elsewhere in the country due to the fact that we have capacity still and they don't, because going back to, as we were saying, our infection rates, whilst an awful lot higher than they were a few weeks ago, a few months ago, are still significantly lower than the rest of the country. And I think the difference between the lowest area in the country, which is Torridge, and the highest area, which is one of the boroughs in London that I can't quite remember off the top of my head, it's about 10 times lower. So there are 10 times as many people in that area that has COVID or have tested positive for COVID than in the lowest part of the country.
Aaron, anything you want to add?
I noticed in the comments there's a few people saying about the various other Nightingales across the country. Not all of the Nightingales have been able to reopen because of staffing issues, staffing pressures within the NHS. So there's been some, obviously, to open another hospital, in effect, which is what the Nightingale would be, we require more staff. And in some hospitals, there's been a notable staffing pressures for a multitude of reasons. And where those staffing pressures are, that means they haven't been able to necessarily roll out the Nightingales again as quickly as they'd perhaps like to.
Okay, so it's a little bit more complicated than maybe what people would take it at face value of.
It's not just a case of, the Nightingales are closed because they don't need them. In some cases, there has been some issues regarding staffing, particularly in places like London.
Okay, well, there was that comment, like you said, about the Nightingale Hospital in London. So hopefully that's kind of going on. There was somebody in the. Can we go? I think shall we go over the general legislation of this lockdown? What people can and can't do, because there's a lot coming in. People asking, can I get my hair cut at home? Can I see my boyfriend? What are the rules this time around?
Well, the general principle of the rules are you should stay at home unless you have a excuse to be outside of your home. Now, those reasonable excuses include sort of work. If you cannot work from home, you can go out for essential activities and food shopping. If as well, you can go out for exercise. You can exercise, with your household or with one other person from outside of your household, as well as be as part of a support and childcare bubble. Other things in terms of the support bubbles, they are where two household, a single person household can bubble up with another household of any size, and they essentially, for the purposes of the legislation, count as one household. So you can have, if you live on your own, you can bubble up with any other household. If you're in a household of two, you can't bubble up with another household of two.
Right. So say, for example, we've got this comment here with Joanne saying, can I assume boyfriend, best friend, I don't know, can I have my BF over, as I think he is in my bubble, I live on my own and lonely. So because Joanne is in a single person household, that means she can, like you said, bubble up.
Provided her other half is not in any other bubble, yes, she could.
Yeah.
There we go.
The guidance is around your bubbles for either support bubbles or childcare bubbles. Ideally, should be local. So someone who lives ideally within the same town as you, if not the same sort of district. As far as I can tell, that is not as part of the legislation. So the guidance is that your bubble should be local, but they don't legally have to be.
In terms of haircuts, which several people have been asking, no, you could not get your haircut done at home or otherwise. Anything classified as personal care whether that be at home or at premises, is currently shut. However, some people can still enter your home, for example, if they're providing care or tradespeople. For example, if you had to have a tradesperson such as a plumber in, that is still permitted. And when that plumber is in the house, it doesn't count towards gathering limits.
Okay. More you know. Fountain of
So
knowledge.
lockdown haircuts are coming back.
I know.
I'm thinking I might need to do it.
I should have got mine done before lockdown, but I just have a fringe down to here in a minute. Right, let's just go back then to, because I know a lot of the questions that are coming in are, I mean, obviously some of them are stupid because, you know, people are winding me up on purpose. So somebody was asking, can a human run faster than a shark? Not relevant to this particular topic of discussion. And some of them I mean, it's a good question. And, you know, some of them, because of the nature of our work, we are not in a position to answer them. But ones that we can look at and analyse are the figures and the statistics, which is why Daniel and Aaron are here. So can we just go back to how things are looking, like, you know, how the spread is looking here in the southwest? I know, Daniel, you gave a brief run through of areas when we started this live stream, because we were talking, there's a few anomalies, aren't there, in Devon, where generally the spread is going through a particular age group, but was it Exeter where the age is different?
Yeah, I mean, as the predominance across pretty much all of the areas across Devon and Cornwall is that the highest infection rates are in the age group between the 20 and 39-year-olds. It's sort of split in terms of the statistics in age ranges of 20 years. So the 20 to 39-year-olds are the areas with the highest infection rates per population of those age ranges in everywhere except for two places in Devon. That's Mid Devon and Exeter, where the highest infection rates are actually in the over 80s at this moment in time. This is based on cases in a 7-day period from December the 25th to December the 31st, which is the most up-to-date figures in terms of specimen dates. They're sort of always sort of 4 or 5 days behind to account for the lag in terms of test results being turned around and results coming through. Those areas, it's, you know, the reason to assume they're more likely to be more of a care home outbreak or infections caught in hospital due to the nature of the age ranges. In terms of, we've mentioned earlier sort of the areas, you know, but the lower, you know, these areas are the lowest in terms of overall infection rates. In terms of positivity rates, this, you know, another figure we can get from the official statistics in terms of the number of tests that are coming back positive. At the moment, you know, again, the highest at this moment in time is Cornwall at 96% of their tests in that 7-day period had a positive result, which is the highest of any of the areas across this region. The overall rate for Devon is 6%, with, you know, some of the areas high. Exeter at 9.2%, potentially again suggesting there might be a care home outbreak in there, which is pushing the figures up. The lowest areas in terms of positivity rates at the minute are both Torbay and Torridge, which are 0.9% of their tests came back positive. You know, the World Health Organization say realistically, to be on top of any outbreaks, you want it to be under 5%. And you've also got West Devon and Teignbridge are under 5% at the moment as well.
So it is a bit of a mixed bag in Devon at the minute. Somebody, I've got to try and find it then, here it is, asking, do our reports decide the tiers? I mean, obviously we're in national lockdown now, but previously we were in tiers 3 and tier 1 briefly for Cornwall. Do our news reports decide the tiers for the country and for the region?
If only we had that power.
Yeah, no, I've heard that Boris, Chris and Patrick are big fans of ours, but no, I don't think we have that influence.
Yeah,
No,
sadly, the news sites, not even just here in the southwest, but all over the country,
no,
we are not responsible for which tier you get put in.
no. Previous to the lockdown, the tiering arrangements were based on a selection of criteria in terms of positivity rates, whether they are going up or down, the age ranges in terms of where cases are, and things around hospital capacity and hospital admissions as well. So they had sort of a 5-6 step criteria that doesn't yet involve how local news sites are reporting the cases. Our reports are just to give people an idea and a flavour as to the situation in the southwest, in Devon, in Cornwall at the moment, in comparison to the rest of the country.
And there's still a lot of interest in it. I know people may feel like it's been going on for a really long time, and the pandemic has been almost 12 months in the making now, but it is something, and I'm sure you guys will know from writing about it a lot, that it is something that people really do want to be abreast of still, isn't it?
Oh, I mean, ultimately, it's no more fun writing it than it is to read it, and I completely get that. But ultimately, if people were left completely in the dark, then people need to be informed. And while some people may disagree with how it's reported sometimes, or you get those that believe otherwise, ultimately, it's our job as news reporters to report the facts of the situation we're currently facing in. And I'm sure I agree with everybody that I can't wait for the day where we don't have to report about this anymore, as much as people don't want to hear about it or perhaps go through it. And hopefully that day will come sooner than later.
Oh yeah, fingers crossed. Well, I mean, we've actually been streaming for half an hour now, which is longer than I anticipated. You guys know more about this area than I do. So is there any other things that you think would be beneficial to cover for our audience, maybe before we wrap it up?
I just briefly mention in terms of how deaths are reported, because I know we get a lot of, you see a death reported and people say, is that a COVID death? Is it with COVID? Is it of COVID?
Oh yeah.
What does it mean? That kind of thing. There's two measures in which the deaths are reported, and they both cover slightly different things. The data you get, either you hear nationally, or you get when we sort of report the NHS England hospital deaths. They are anyone who has died within 28 days of a positive COVID-19 test. Now, that's not to say every single person who died of COVID. There will be a minority of people who COVID was just completely incidental to their death. They died of other things that it's the person who had asymptomatic COVID and was hit by a bus scenario.
Okay, so that scenario is real then.
Whether it's real or
it's very unlikely, but
it's the theoretically they would count as part of the 28-day measures. Now, I don't know exactly how many of them there are, but the vast majority of the people who do die within 28 days of a positive COVID-19, COVID has got some cause towards their death. We can then sort of follow this with a second measure of deaths we get from the Office of National Statistics, and they come out once a week, and they're sort of looking back at essentially the period between, I think it's 10 to 17 days prior in a weekly period, and they record all deaths in which COVID-19 is mentioned on the death certificate, either as the cause of the death or a contributory cause of the death. And they don't have to necessarily follow that somebody has tested positive for COVID, but if it is considered to be a cause of their death, then that it's counted in there. Broadly speaking, the two measures, although theoretically could be two entirely separate measures, are in the producing similar-ish numbers of deaths each week, so that it gives you an idea that the vast majority of the deaths you hear reported each day are, or COVID at least contributes in some way, even if it's not the sole cause of of those deaths.
So despite the kind of postscript on the bottom saying, died within 28 days of a positive result, even though hypothetically somebody could have been run over by a bus and been asymptomatic and had nothing to do with it. The statistics show that generally speaking, they are, accurate to COVID having had some kind of impact on that person's passing.
Yeah, it's not 100% the crossover between the two figures, but they're broadly in the same range in terms of, if you looked at a 7-day period in terms of hospital deaths, and then the same 7-day period in terms of the ONS deaths. There, you're looking at, you could put a handful of either way, which gives an idea that the vast majority have got, are related to COVID in some way.
Aaron, any other tidbits that you want to throw in before we wrap it up?
Yeah, sure. So there's been a few questions to do with schools and vaccines. So firstly, with schools, the situation is they're closed until at least mid-February. I mean, the government are aiming to get them reopened February half term, but a lot of that depends on the vaccination program and the issues around that and whether they can get enough people vaccinated. So it's all in the air, but the review is mid-February. It may be extended further. It may be slowly. The restrictions may then go back to a tier system, but with like a rolling sort of release of restrictions as more people are vaccinated. That's not yet entirely clear. In terms of education, my understanding is that there are currently still discussions about what to do with exams this year, whether they'll go ahead or not, although it's looking likely they may not, and the assessments will be done by teacher assessment, which is what many were calling for last year. In terms of vaccinations, there's a couple of questions about when people will be contacted. If you hadn't been, this was covered last night by a couple of people involved in the Devon vaccination program, and they basically said, if you haven't been called yet, don't worry, you will be called. So it's not a case of people being missed out. Don't call your doctors to ask when it is. They will contact you.
Yeah, that is very important to add, isn't it? So that we don't kind of over egg the people trying to turn up and getting vaccinated, right, and mess up the pattern which has been laid out. I've put my glasses on so I can see the screen again. Brilliant. Well, thank you both for jumping in on this Facebook Live. This is a kind of new area that we are pursuing here on Devon, Cornwall and Plymouth Live, and hopefully we'll be able to bring you some more Q&A style videos. Maybe Aaron and Daniel will be back. I know we're going to try and do some with the whole news teams over the next couple of weeks, especially with lockdown 3 happening. Hopefully some of you have found the information Aaron and Daniel have talked about useful. I certainly have learned more in this half an hour than I have attempted to in a long while. So that's been really helpful. And if you have any questions, or there's things that you think what you want covering, I know there was somebody in the comments earlier mentioning about schools and how they wanted to talk about the exam process. You can just get in touch with us on one of the Facebook pages, and we'd be more than happy to talk to you about any issues that you're facing around COVID in your local communities, or anything at all that you're facing in your local community that you think is newsworthy. So thank you very much to Aaron and Daniel. Thank you to those of you who have watched. You guys are both lovely legends. Love to work with you. Thank you for turning up today. And we're going to hang up and we'll still be here, so we can chat then. But for the sake of this Facebook Live, thank you very much. And we will catch you all on another Facebook Live soon, I'm sure.
Are you bringing back the quizzes?
I am going to bring back the quiz next week. I'm having an evening off. I'm just going to sit at home and not do anything this evening. Right, okay, we won't take up any more of anyone's time. Thank you very much, guys. I am ending the live stream now. See you later.
Cheers.